After the age of 60, masturbation is not just normal, it is essential for your health. And today, I will share with you the 7 secrets that every man over 60 needs to know. I am Dr. Jocelyn, a psychiatrist, psychotherapist, and writer. For decades, I have studied human emotions, emotional intelligence, and the secrets of the mind. Today, I want to share with you what I have learned in my clinical practice, in my research, and in my interactions with thousands of patients and readers. I have worked in the field of men's health for over 3 decades, dedicating my career to understanding the intricate connections between mind, body, and well-being. And let me tell you, over these 30 years, I have seen it all. But there is one thing that still surprises me: the number of men who suffer in silence because no one has the courage to talk about it. Before I continue, let me ask you something. What if I told you that there is something you can do daily that costs nothing, doesn't require medication, and can improve your health, mood, and vitality? Wouldn't you want to know? Well, that's exactly what we're going to talk about today. And no, it's not about a miracle supplement. It's not about Viagra. It's not about anything you need to buy. It's about something your body already knows how to do. But you may have stopped because someone told you it was no longer appropriate for your age. The story of Ricardo, a real case of prostate congestion. Let me tell you a story. Last week, I received a patient in my office. Let's call him Ricardo. Ricardo is 68 years old, retired, and widowed for 3 years. He came in complaining of pelvic pain, difficulty urinating, and that constant feeling of a full bladder even after going to the bathroom. All the routine exams were done. Rectal exam, PSA, ultrasound. Everything was within normal parameters. But his prostate was inflamed, congested. And when I started asking the right questions, I discovered something interesting. Ricardo hadn't had sexual relations since his wife passed away. And when I asked about masturbation, he turned red, looked away, and said, "Doctor, at my age, that's not something a respectable married man does." And that's when I realized Ricardo was suffering not because he had any serious illness. He was suffering because he had completely abandoned his sexual health, thinking it was inappropriate, wrong, or unnecessary at his age. So I asked him, "Ricardo, when was the last time you ejaculated?" He thought for a moment and replied, "I think it's been about 2 years, doctor." 2 years. Folks, your prostate doesn't understand mourning. It doesn't understand age. It doesn't understand social conventions. It is a gland that needs to function. And when it doesn't function properly, you have problems. Now, before I continue, I need to debunk the biggest myth about male sexuality after 60. The idea that when you reach a certain age, 60, 65, 70, you should stop all of that. That's a lie. It's a dangerous lie that is harming millions of men right now. The truth is that your sexuality doesn't have an expiration date. It changes, yes. It evolves for sure, but it doesn't disappear. And ignoring this is not being respectable. It's not being mature. It's actively harming your own health. So let's get to the 7 secrets. And I want you to pay close attention because each of these points can make a real difference in your quality of life. Secret 1, prevention of prostate cancer. Secret number 1, regular masturbation significantly reduces the risk of prostate cancer. This is not my opinion. It's not a belief. These are scientific studies, research conducted by renowned universities around the world. In my clinical practice and in the research I follow, I consistently observe that men who ejaculate at least 21 times a month have a significantly lower risk of developing prostate cancer. 21 times a month, folks. That's about once every day and a half. And we're not necessarily talking about sex with a partner. We're talking about ejaculation, however it happens. Why? Because when you ejaculate, you are literally cleaning your prostate. You are expelling toxins, bacteria, old cells that accumulate there. It's like flushing a system that needs to function. Secret 2, reduction of congestion and inflammation. Secret number 2, masturbation reduces congestion and inflammation of the prostate. Remember Ricardo? His prostate was inflamed and congested. Do you know why? Because when you stop ejaculating, your prostate keeps working. It continues to produce seminal fluid, and this fluid needs to exit. If it doesn't, it accumulates. And when it accumulates, you have congestion. And congestion leads to inflammation. And inflammation leads to those annoying symptoms: pain when urinating, a feeling of heaviness in the pelvic area, frequent need to go to the bathroom, especially at night. It's like having stagnant water in a tank. If it doesn't circulate, it rots. Your prostate works on the same principle. It needs movement, renewal, circulation. Secret 3. Maintenance of erectile function. Secret number 3. Regular sexual activity maintains erectile function. This is what I hear most in consultations. Doctor, I can't get an erection like I used to. And when I ask about frequency, many tell me they simply stop trying. Folks, your penis operates on the principle of use it or lose it. The erectile tissues, those cavernous bodies that fill with blood and create an erection, need to be exercised. They need regular blood flow. When you completely stop, those tissues begin to atrophy. They start to lose elasticity. The arteries that carry blood there begin to decrease in diameter. And then, when you finally decide to try again, it no longer works properly. It's like a car that sits in the garage for years. When you try to start it, it won't turn on anymore. The components rust, dry out, and stop functioning. But if you maintain regular activity, even if it's just masturbation, you are keeping everything functioning. You are maintaining blood flow, keeping tissues healthy, and keeping the system operational. Secret 4. Improved sleep and reduced stress. Secret number 4. Regular ejaculation improves sleep quality and reduces stress. When you ejaculate, your body releases a powerful combination of hormones and neurotransmitters: prolactin, oxytocin, endorphins. These natural chemicals have a relaxing effect, reduce anxiety, and improve mood. Prolactin in particular is the hormone that gives that deep relaxation feeling after orgasm. That's why many men feel sleepy after sex. It's not laziness. It's not a lack of interest. It's biology. And for those of you who have trouble sleeping, who wake up several times during the night, who toss and turn in bed thinking about 1,000 things, masturbation before bed can be a powerful tool. No medication, no chemical dependency, just using the natural pharmacy of your own body. Secret 5. Maintenance of cognitive function. Secret number 5. Sexual activity keeps the brain active and healthy. This surprises a lot of people, but over decades of treating patients, I've noticed that sexually active men have better cognitive function, better memory, and better concentration ability. Why? Because sexual activity, including masturbation, is a complex activity that involves multiple areas of the brain. It involves physical sensation, emotional processing, imagination, and memory. When you masturbate, you are not just touching your body. You are activating memories, creating fantasies, processing visual stimuli if you are watching something, coordinating movements. It's a complete brain workout. And for those of you who are worried about Alzheimer's, dementia, or memory loss, keep your sex life active. It's one of the best ways to keep the brain young. Secret 6. Strengthening the immune system. Secret number 6. Masturbation improves the immune system. In my clinical observations and the studies I follow, I see that men who have regular orgasms show higher levels of immunoglobulin A, an important antibody that defends the body against infections. The white blood cell count also temporarily increases after orgasm. So yes, literally masturbation can help you avoid that flu, that cold. It's not an absolute guarantee, of course, but it's one more tool in your health arsenal. Secret 7. Reconnection with your own body. Secret number 7. Conscious masturbation reconnects you with your own body. And this may be the most important of all, especially for those of you who have lost partners, who are alone, who think your sex life is over. Masturbation is not just about physical relief. It's about reconnecting with yourself. It's about saying, my body still matters. My pleasure still matters. I still matter. After 60, many men completely disconnect from their own bodies. They stop paying attention to sensations. They stop caring. This is sad, folks, because you still have decades of life ahead. Decades that can be lived with vitality, with pleasure, with connection. Now, I know what some of you are thinking. Doctor, but I was raised differently. In my time, this was a sin. It was shameful. It was something we didn't talk about. And I understand. I really do. Many of you grew up in a time when sexuality was taboo, when masturbation was considered dirty, wrong, immoral. You were punished, ridiculed, or shamed for it. And carrying that shame for decades leaves marks, deep marks. But I am here today to say one thing. Those messages you received were wrong. They were not based on science. They were not based on health. They were based on control, on repression, on fear. The truth is simple. Masturbation is natural, it is healthy, and it is important for your physical and mental well-being, period. The 3 serious mistakes you must avoid. Now, there are 3 serious mistakes that many men make when masturbating after 60, and I need you to pay close attention to these points because they can make the difference between a healthy experience and a harmful one. Mistake number 1, excessive speed and lack of lubrication. Many men, especially those who masturbate quickly out of fear of being caught or out of shame, develop a pattern of fast, dry friction. This can cause microtraumas to the skin of the penis, irritation, and even condition your body to respond only to very intense stimuli. After 60, your skin is already naturally thinner and more sensitive. Using lubricant is not optional. It is essential. It can be water-based, silicone-based, whatever you prefer, but use it and go slowly. It's not a race. Mistake number 2, relying exclusively on extreme pornography. Look, I'm not here to judge what you watch, but I need to warn you. Many men develop a dependence on increasingly intense and extreme stimuli, and this can desensitize you. When you can only get an erection or ejaculate with very specific, very intense pornography, you are creating a problem because your brain is being conditioned to respond only to that type of stimulus. Try to vary. Use your imagination. Sometimes recall real experiences you've had. Reconnect with your own body and your own sensations, not just with images on the screen. Mistake number 3, ignoring signs of pain or discomfort. Guys, if it hurts, stop. It seems obvious, but many men ignore pain because they think it's normal, that it's part of aging. It's not. If you feel pain when ejaculating, if you feel burning, if you see blood in the semen, if you have pelvic pain that doesn't go away, you need to consult a urologist. These can be signs of problems that need treatment. A word for those who are alone. Now, I want to speak specifically to those of you who are alone, who have lost your wives, who are divorced, who for any reason do not have partners. I know it's hard. I know it's not the same. Intimacy with another person, touch, emotional connection, all of that is irreplaceable. And I'm not saying that masturbation replaces that. But while you don't have a partner, while you are alone, masturbation is your way of maintaining sexual health, of staying connected to your own body, of taking care of yourself. It's not sad, it's not pathetic, it's not shameful. It's self-care. Just like you brush your teeth, you exercise, you eat well. Masturbation is part of taking care of yourself. And for those who have partners but no longer have frequent sexual relations for any reason, her health issues, lack of interest, differences in libido, masturbation is not cheating. It is not disrespect. It is health. You can deeply love your wife and still have physical needs. And meeting those needs alone does not diminish your love for her. It does not lessen your commitment. It is just taking care of one aspect of your health. Ideal frequency. Now let me talk about frequency. Many ask me, Doctor, how many times a week is ideal? The honest answer is, it depends on you. There is no universal magic number. Some men feel good with twice a week. Others prefer every other day. Still, others can maintain a daily frequency. The research I follow suggests 21 times a month for maximum protection against prostate cancer. But that is a statistical average. The important thing is that you maintain some regularity. If you haven't ejaculated for months, start slow. Don't try to make up for everything at once. Your body needs to readjust. 1 or 2 times a week is already a great start. And another important thing, pay attention to quality, not just quantity. A conscious masturbation where you are present, attentive to sensations, connected with your body is worth more than 10 done mechanically on autopilot. Take your time, don't rush. Create a pleasant environment. Relax, breathe, explore your body. Discover what still gives you pleasure. You might be surprised. Some practical tips I give to my patients. 1. Establish a routine. It can be in the morning or at night before sleeping. Having a regular schedule helps normalize the practice and removes that feeling of doing something hidden. 2. Always use lubricant. I've mentioned it before, but I repeat it because it's important. Protect your skin. 3. Vary the techniques. Don't always use the same grip. the same speed, the same position. Explore, discover new sensations. 4. Exercise your pelvic floor. Those Kegel exercises that are usually associated with women work for men too. They strengthen the muscles that control ejaculation and improve the quality of erections. 5. Stay hydrated and eat well. The quality of your semen, the strength of your erection, all of this depends on your overall health. And last but not least, talk about it. If you have a partner, talk to her. If you have close friends, talk to them. The more we normalize these conversations, the less shame we carry. I know that for many of you, this is still difficult. Generations of silence don't break overnight. But every honest conversation, every time you allow yourself to be vulnerable about this subject, you are helping to break that cycle. The final message. What I want you to understand, to really absorb, is this. Your sexuality is an integral part of your health. It's not a luxury. It's not extra. It's not something you can simply ignore without consequences. When you take care of your sexual health, you are taking care of your prostate, your heart, your brain, your immune system, your mental health. Everything is connected, and it doesn't have to involve a partner. It doesn't have to involve a relationship. It doesn't have to involve anything beyond you and your own body. You are not broken. You are not too old. You are not alone. There are millions of men in your situation with the same doubts, the same fears, the same needs. The difference is that now you have information. You know the truth. You know that taking care of your sexuality is not shameful. It's health. And you can make conscious choices about how you want to live the rest of your life. So my final message to you is this. Give yourselves permission. Permission to feel pleasure. Permission to take care of yourselves. Permission to be healthy in a holistic way. Not with magic pills, not with guilt, but with presence, with awareness, with self-care. Because you deserve it. Your bodies deserve it. And the decades of life you still have ahead deserve to be lived with vitality, with health, with pleasure.